Very good. Very good. I'm just going to finish up the immune system. We'll call it a day. It's already been eventful. So on that, furthermore, on that note, here we are. So the immune system is great until it gets out of control, until something happens, and it's always there. I mean, maybe that's the best way to frame this and to appreciate the severity of immunological phenomena. I cannot overstate when someone has an immunological flare like I did, how it's almost intolerable. And there's very little because your body effectively is attacking itself in some way, shape, or form. It's either producing cells that are attacking other structures, chemicals that are attacking other structures from within. And I mean, and it takes extraordinary measures and powerful medicines to be able to deal with it. And maybe that's the best frame for a lot of these things. And it can be something that's trying to be done therapeutically. For instance, organ transplantations. So understand, I'll do this part and come back to the other part. When we're talking about and I thought they would have had this here. Maybe I missed it. With the organ transplantation stuff. Where did they put this? Okay. They changed the way the PowerPoint was, so pardon me for going through this. When we're talking about organ transplantation, there are 4 types of grafts. Okay. There's something called an autograft. That's when you graft tissue to yourself. So, and I have done those on multiple occasions, taking bone from one area, commonly done in orthopedics, where we'll take a piece of bone that's good and sturdy from a large source like the tibia, which is strong cortical cancellous bone. And when you're going to try to put it in between like 2 parts of a fracture and screw it in there, it might not heal. So doing bone grafts, we call autogenous bone grafts. Why it's so useful? Because they're not going to be rejected. It's your own bone. And so there's also something called an isograft. Iso means same. Auto obviously means self. Iso, the only way you would have same is if you had very unusually, an identical twin. And moreover, an identical twin that was truly identical, because there are some variations in identical twins that are called chimeric, like the old mythological creature, the chimera, that sort of mixture of things. That way they'll have above the waist, there'll be one genetic, and below it'll be another genetic. Some really oddball things, okay, that are there. All that aside, it's pretty rare. So most grafts, other than bone grafts, and I did skin grafts, taking pinches or pieces of skin and grafting them to other areas. And I was very thankful that in bone and skin, since it was from one person to another, as long as you're doing good technique, they took. I mean, it's not easy. And I was happy to have a certain amount of say. Most grafts are what we call allografts. Allograft just means same species. And so typically, if it's a kidney transplant, it's somebody else's kidney. If it's a heart transplant, somebody else's heart, obviously. Bone marrow, the same one. So all of those are different aspects of it. And it's not done there. We also have xeno, X-E-N-O grafts, and that's from a different species, or a foreign species would be the way that would sure be the word derivation. Like someone who's xenophobic doesn't like foreigners, that type of stuff. Because here we're not Native Americans, we're all foreigners. But I digress. But a xenograft, and we've used them for a long time. We use porcine or pig-based heart valves frequently. We were using pig-based for tendon and ligamentous repairs in the ankle, because they were and had a remarkable degree of compatibility. And it's funny, genetically speaking, let me phrase that. Antigenically speaking, sometimes it's a better match than something that we're more genetically comparable with. So you think that we would all fall more likely to be compatible with, I don't know what the politically correct term is for the ape family. I mean, I don't want to call simians. Monkey might be pejorative. Chimp, the chimp could be a chump. But you know what I'm saying, orangutan. But you would think that by to me genetically they might be more compatible, but not necessarily true. And so what you do have to do is make sure that you use those MHC antigens, the closer the match, it lessens the rejection phenomena. The rejection phenomena today has been changed a little bit. For years, these folks had to frequently be on immunosuppressive drugs the rest of their lives. And the problem is that you're always at risk of infection. So now what they have started to do is utilize a certain amount, if they can acquire bone marrow from the source of the donor, then you would be able to lower the rejection phenomena and lower the need for a lifelong course of immunosuppressive agents. You see, and that's, I mean, the minute it's like what happened to me. Were you trying to do the immune suppression to fight a cancer, albeit successfully, but triggering an immunological phenomenon that I was predisposed to? Go figure. So you can't win. There's a very, very delicate balance. Okay. So when your immune system is suppressed, it can't protect you as well. Even if you're doing it by choice, because you have to deal with a transplant that's there. So leading cause of death among transplant recipients, certainly infection, certainly rejection phenomena. Okay. That's where they come from. And look, I mean, now again, PowerPoints like this are probably effectively 8 years old. If you're looking at the statistics, they're probably due for a new edition of this. I'd be curious to see what the statistics are vis-a-vis rejection for allografts with today's therapy. I would wager it's greater than this. We call that the 10-year survival rate. Whenever you see that, when you hear about survival rates, it's like a diagnosis of cancer. So the 10-year survival rate is 50% for, on average, whenever this was published. That's still a whole lot better than not having those 10 years. I mean, I used to wonder years ago. I mean, I was friendly with a nephrologist, and I mean, there was a time when people were, if they had to be on dialysis, the lifespan was 7 or 8 years once they started. And I had asked her about this, and she said, no, we've got people 20, 25 years with modern technology. This was 20 years ago. It happened before I was teaching full time. I was tutoring her children, math and science, tutoring her children, because she and her husband, both doctors, were very, very busy. Talk about smart people. Wow. I was a piker there. Gives you some idea. So, immunodeficiencies, there are not all of them. This is a very famous one that is congenital. Most of them fall under acquired, and that's where HIV comes from. So, congenital or acquired conditions, this is referred to classically as SCID. Years ago, there was absolutely no treatment. Now, we have bone marrow transplants because we're able to basically create an environment which will favor T cells. So you don't have the limitations of B cells and T cells as described here. Years ago, they used to call this the bubble boy syndrome. I don't know if you're familiar with it. And effectively, that's someone with this was so at risk, they had to be literally isolated completely from contact with other people, even though they could, as long as they were in that kind of a quote sterile environment, they were fine. So it's really kind of sort of an interesting. John Travolta, when he was very young, played that particular part because there was a book written about, and they had some fun with it on a Seinfeld episode. TV show some years ago. Yeah, George kind of messed it up. Larry David based George on himself. Hodgkin's disease. Okay, this is another one we know there's viral causes and disease-based causes of this as well, but cancers of B cells. Okay, in the lymph nodes. So there's Hodgkin's and non-Hodgkin's based diseases. Hodgkin's is depends. I don't want to paint with a broad brush, but they're both, lymphomas are more treatable than a lot of other cancers. Lymphoma is frequently a diagnosis that you can literally, if you want to put it this way, you normally want to have somebody have cancer, but you could live with that. And then lastly, and the one that's most familiar, is the viral origin of acquired immune deficiency syndrome, I'm doing the same unit with my A&P people. You're going to get the same freaking anecdote if you haven't had it already. Okay. It is the biggest problem, helper T cells. It targets the single most important cell in your immune system. It either invades it or destroys it, or it invades it and converts it into a factory to make viruses that invade or destroy or convert all the other helper T cells. So over a 2 to 10 year span, in the absence of either appropriate, adequate, or any treatment, if it's not treated properly, the average time, because it's a slow virus, over 2 to 10 years, it will cause your helper T cell population to collapse in such a way that the absolute value or the absolute number of helper T cells in your blood tests to a significantly low level, and at that point, you are now no longer HIV positive. Now you have what's called HIV/AIDS, and all that means is your immune system has collapsed. When they say it's a syndrome, it's like diabetes. It's an accumulation of signs and symptoms. Here, it's characterized by a collapse or a lack of absolute helper T cells, and at that point, you're going to die sooner than later. That's the definition of fatal. You're not going to have your life expectancy. Yes. AIDS medications work on. It's a good question. AIDS medications work. Save me having to go here. I don't know if you did this in micro when you had Dr. Maurer for 2390. So here, our cell. Okay. Here's the HIV virus. Okay. It has to attach and enter. It has to uncoat. It has to basically synthesize. Has to assemble, and then subsequently it has to release. That's typical of any virus. What makes HIV unusual, and everybody would know this, you would think, it's a retrovirus, an RNA retrovirus. So, because of this unique structure, it obviously rewrites itself as odd. The frame is this. DNA viruses tend to become latent and incorporate with cells, like your helper T cell. RNA viruses mutate like crazy. So it's the worst of both worlds. Not only does it rewrite a DNA, but it mutates very rapidly. So now you have to use, old days 3, nowadays 4 antivirals. So we tailor them to this. Remember, what enzyme does it have? RNA reverse transcriptase. That's an enzyme. It has something called protease. When it assembles its proteins, it's a long strand called a polyprotein. So you have the capsid proteins, the protein spikes, and reverse transcriptase, and you have to chop them, and the enzyme that you use is called protease. So it separates them so you can assemble the virus. So you have a lot. The complexity of its transcription strategies, what we refer to these in the trade, it gives you a lot of targets. So you can target entry agents. You can have reverse trans inhibitors. My handwriting is getting worse. Reverse transcription, you don't have to know anything. You have protease inhibitors. And another one, I think of the term that they use, when basically it incorporates, I just saw the term the other day, when it incorporates with the host cell genome, whatever that that effectively becoming part of that. But there's inhibitors for that. So entry inhibitors, reverse transcriptase, protease inhibitors, base analogs are all part of how. So there's 4 or 5 different ways, and the reason you have to use at least nowadays 4 is it mutates so rapidly. So that's how you treat it. That should, I hope that answers it. We understand it and it's been very successful. That's, if it's recognized, I mean, there's absolutely no reason somebody who's HIV, one Magic Johnson. Okay. So, I mean, obviously, does he have the best of care? Is he a world-class athlete in his day? Do you identify it early? Do you do all the absolutely? That's, so there's, and he's not the only person that about that has this. So HIV is something that basically does all of these things. It was identified because it caused this particular it's a fungal pneumonia. Healthy people don't get fungal pneumonias. The only people who get fungal pneumonias are those who are in an area where it's prevalent. You're constantly inhaling it, like the desert Southwest. That's where valley fever is, San Joaquin Valley fever, known as valley fever. Or you're a caver and you get coccidiomycosis. Coccidio San Joaquin histoplasmosis, which is spelunker's disease for moist caving. Or you have some underlying disease that limits your immune system's ability. And the doctor in San Francisco identified in gay men, because there was a very large population proportionally, back in 81. I'm sure it was before that, but he published in 81, this pneumonia called PCP, which stands for pneumocystis, that's the PC, Gerevicii, was the name we call it now. It had a different last name then, because it was so rare. And then he backtracked and found they all had limitations in their immune system, hence the definition of AIDS. We were seeing it in Philadelphia in 1976. Because the two largest gay populations per capita, percentage-wise, were San Francisco and Philadelphia for big cities, no question. And if anything, Philadelphia had a larger population compositely total. My first wife and I were very good friends. Didn't I tell you she was the date for our downstairs neighbor who was gay and couldn't come? In 1977, you couldn't come out. She was his date for the office Christmas party, for the awards dinner. They would have raised an eyebrow if this, nice looking, not maybe 30-year-old guy is coming by himself and so, one of you two kids going to get married, you're such a nice couple. And she said, do you mind? And I said, of course not. Because I knew they would raise eyebrows and questions, because back then people were, to be kind, very unenlightened. We better say they were intolerant. You don't have to approve of it, but let everybody do their own thing. It doesn't hurt you. So, I mean, all that aside, I mean, one of the things that was a hallmark of this was this Kaposi sarcoma. A typical physician prior to this would be unusual for them to see one case in a career. I saw 2 cases in 6 months. Hold on, how's that? So and that population of this fellow's name is John, his friends, we're sitting there having lunch with this group of gay men, one of whom was clearly, retrospectively, in AIDS, full blown. I mean, he could hardly keep his head up. He was frail. He was coughing. I mean, he was there. And we would talk. He said, and they would talk amongst themselves and say, "Oh, he has it," or "he has it." All they could say was "it" to represent AIDS. We were very aware. We didn't know how to treat it. We knew there were massive infections. We knew people were dying, but there was nothing to treat it with. They started to use anti-metabolites, and those were anti-cancer drugs. And the first one was AZT, which is a thiamine lookalike base analog. Didn't work effectively, and and the only reason medications became readily available was because something back in 1988, they passed the Orphan Drug Act, which had nothing to do with orphans. It gave financial incentives to big pharmaceutical companies to make medications for diseases that did not have a lot of victims. And it allowed them to fast track it. It's about the money. Right now they don't want to make antibiotics. There's no money in it. Why did they pass this drug act? Because the big power players in Hollywood with the big bucks, who basically put those. I don't know about you. I haven't made any $250,000 or $1 million campaign donations this week. Just me. Maybe next week I'll let you know. And what they did, because people were dying. Liberace was a very interesting entertainer. That was there was a great HBO thing that Michael Douglas was just a fabulous job of, called The Last Candelabra. It was the first case of what was called palimony. Matt Damon was the pal, and there was an HBO show. But more importantly, Rock Hudson, the action star, manly action star. Hollywood knew he was gay, but he couldn't be starring as the lead role in action films, as the submarine commander, and you couldn't be that, and all these wonderful love comedies with Doris Day that sold $1 zillion. But when he died and succumbed to it, then all of a sudden Hollywood promoted it. It's a very interesting chronology of it. And people didn't understand it. If somebody was HIV positive, they wouldn't touch them, they wouldn't go near it. I mean, I was looking at last time I was at the gym, and you see one of these doctor shows. It was a comedy, and everybody's got the gloves, the vinyl gloves on. They didn't wear gloves. Someone came in the emergency room. We didn't have masks and gloves and gowns on. Who knows what they had? It was almost 50 years ago. I'm still here. Stop worrying about shit like that. Goodness gracious. And we know how it's transmitted and all that type of stuff. So I wanted to get through that. I'm going to run out of time here. The helper T cells. Lymph nodes, about 10 years. All sorts of bad stuff. Yeah, the pro virus, this is when it incorporates. One is an entry agent. I'll have to look up the other term for what I couldn't remember. Okay. And these are the autoimmune diseases. What I put up there was that bell curve. It was just to reinforce to my A&P students that about 10%, it's a bell curve. With autoimmune diseases, 10% of the people have the diagnosis, has no impact. It's though they didn't have the problem at all, be it rheumatoid arthritis, systemic lupus erythematosus, even MS. 10%, you wouldn't even want to conceive of how sick they are. They're going to die very soon. In between those bigger branches of the first standard deviation from the mean, those 40% that are over there, you're on the good side, the minimal severity side. You probably take medicine, you could work a job, you probably get it with a sore, maybe there's some kind of biological agent that you take to function. The same way I did for a couple of years. Now I don't have to take them. This side affects those things. You want to be on this side, and obviously it progresses from being very limited impact to greater. And now once you cross that line into the bad half, it affects your ADLs. Don't know what ADLs are, you should find activities of daily living. Whole branch of science called occupational therapy is based on that. ADLs mean combing your hair, brushing your teeth, going to the bathroom, taking a shower, making breakfast. Making the bed. You can't do any of those things. And when someone's impacted, it's a game changer. Now, I remember what happened with my mom when finally her shoulders just gave out and she just couldn't do those things anymore. She couldn't drive her car, and then stroked her. She was more than 86 years old, and then after it's amazing how life-changing it is. These are just examples of the various ones. We've covered some of these. What's interesting is where they impact. Lupus and type 1 diabetes, I know it destroys pancreatic cells, but one of the highlights are that they form and lupus is in connective tissues. They both form in the kidney these big lumps of antigen antibody complexes. That's how we just thought they were a byproduct of diabetes. Now they know they were immunological complexes in type 1. The leading cause of kidney transplants and being on dialysis, diabetes. What's second? Lupus. Most common, rheumatoid arthritis. And you have, sometimes these are antibody, most of these are antibody based. Okay. Sometimes they're byproducts that they adhere to joints. Here, they impaired the neuromuscular junction. Here, myelin, that there's a very large statistical association with human herpes virus 6, which causes a disease that I'll bet all of you had, if not all, 90%, because most of us have been exposed to it, called roseola. There's a statistical association with that. All those are part of it. And again, all of these things. Now, for years, the linchpin was steroids and other agents. Now, all these, what they classically refer to now as biologicals, all of these, like I was taking, the Humira or the Cosentyx or the Enbrel, all of these are agents that are targeting all of those cytokines agents and either enhancing them or blocking them. It's very, very difficult for me to tolerate. I mean, not that I couldn't have taken them and survived. I didn't like it. My wife is very adamant. She felt that that my reaction to them when I took them really, I could have done a lot better by living a healthier lifestyle, eating better, and getting my skinny butt to the gym. So I was there last night. That's all right. I just like to look like a, you
You like that machine?
I like the treadmill.
Yeah. I don't really.
I get my headphones on. It's like, you kiss the girl, and I think I love you. I'm that guy. You can't. Nobody. I never have to worry about having a machine. Anybody on either side of me, they move. So all of these things, failures of self-tolerance, mutations, all play a role with regard to this. And lastly, we don't have enough time to go through all of these. The typical allergy, IgE mediated. And so we vary them based on their time course and whether they involved antibodies or T cells. Most of these are antibody based. So the immediate ones, then subacute, and then the easiest one is the delayed. The delayed response is T cell mediated. What happens is it takes 48 to 72 hours to basically cause whatever the agent is to enter the cell, alter it, and have T cells come to the party. You've all had it, a tuberculosis test. If you respond, if that little subdermal injection blows up right away, it's an allergy. It's a protein. It's called PPD, purified protein derivative. 48 to 72 hours because it's cell mediated. It's not an immediate response. That's where it comes with the time. That's there. Other things that are like that, poison ivy, from resins that are absorbed, contact dermatitis. Like, it's summer, you went out and got a new pair of sandals or leather, they got wet, and all of a sudden the resins get into your skin and get absorbed, which is very similar to what poison ivy does. There's contact dermatitis. Type 1 classic allergies. Okay, sensitized with the first contact, IgE binds, all those mast cells, basophils. The second one, whether it's like me and you're coughing and sneezing, or depending on where they're clustered, potentially the worst possible one being an anaphylactic shock. And again, we see that much more frequently with things like nut oils and bee stings. Typically, it's not, nut oils are about the only thing that are classically ingested. So if you have, and those people have to have it, you'd be foolish. I have a stepson who's allergic to bee stings who doesn't carry an EpiPen. Not brilliant. Someone who's 44 years old now. Not brilliant. Okay. Horses, water, drink. So nevertheless, the typical things, so most of our immediate hypersensitivity could be standard allergies. It could be a cold coming on. We respond the same way. If it's more lung-based asthma, you can use antihistamines, you can use steroids. Yes, Joey?
So, one of my neighbors has young, like very, very young child, probably like 1 or 2 years old, who has an allergy, but they're acclimating him to the allergy so it doesn't like persist later in life. Why is that only possible when you're very young and not older?
I don't know that that's true. I mean, I do not know. You can do desensitization older, as well, as far as I know. You know, because I had thought about with all the allergies I had, I snored, and we thought it was all. I ended up having, I had broken my nose a number of times in sports, putting my big nose where it shouldn't be. But yeah, I think I do not. Short answer, I don't know. I think it is more effective in children. So you can use desensitization for that. Immunology is very, very, very complex. Here's the anaphylactic shot. I mean, it's a good idea if it works. I mean, there's no guarantee it would work that I would think. But I mean, because when I went, they were going to do a whole bunch of testing. This allergist I went to, and he's like, this, and it sounded like a whole bunch of work having to come in there every X amount of, every couple of weeks and get shots. And I'm like, maybe not. I was busy in practice anyway. And then you can go through the slides here. Subacute, this is the blood transfusion one. Again, typically, this is more associated with antibodies as opposed to mismatched cells. And that's typically the one they were advising me about when I was having a transfusion. It typically took a couple of hours. So when I went home, they said, every half an hour, check your temperature if it starts to go up, or you have this, that, etc. And then this one is the antigen antibody complexes this is the mismatched blood one, rather. And that one, because the hemoglobin, because the red blood cell lyses the hemoglobin, clogs blood vessels, problematic. And then lastly, this is the antigen antibody complex one that is so significant with lupus, probably something similar in diabetes, as well as damage to pancreatic cells. And then a delay. And that's it. We're good. I will see